My sister bullies pregnant women and brags about giving them a nurse dose, so I told her to find a different career and reported her to the hospital. My sister has worked as an L&D nurse for a few years. She has always wanted to be a nurse and even said it was her calling. Lately, she has been making horrible remarks about the mothers that come to her. Now, I understand that every job has problems, and sometimes, you need to vent about rude people, management, and pay. However, this was not like that. For example, she talked about one of her patients, called the white whale. My sister said that the white whale went into labor and brought her husband with her. She talked about how hot her husband was and how she could not understand how a whale was able to pull someone like him. She laughed when recalling the sound she made when pushing out her child and said that she didn't look like the type of woman to be strong enough to go the natural route. In the past, she has talked about how another mom-to-be defecated on the table, and she remarked that she wouldn't be surprised if her husband divorced her after seeing something so nasty. Other stories included a teenage patient who just couldn't keep her legs closed. My sister claims she gave her some sound advice. I'm honestly scared to know what she said to this young girl. With this girl, my sister laughed about how she gave her a nurse dose of pain meds to get her to shut up and refused to give her a blanket since if she wants to act like an adult, then she deserves to be treated like one. The fight between her and I happened a few days ago due to her talking about a mother who delivered a premature baby. She admitted that she told this mother that she should have done a better job if she didn't want to have a baby born at 29 weeks. I blew up at my sister and asked her how she could be so heartless. My sister told me that she should have the right to vent about stupid mothers who don't know how to do the thing their body is designed for. She also said that I don't work in healthcare, so I have no right to remark on how she handles stress at work. I told her that if her way of handling stress is to be a misogynist, then she needs to find a different career. I left afterward. I feel bad for some of the things I said, and I know that she needs to let off steam, but saying horrible things about women in their most vulnerable times isn't cutting it for me. In addition, my family does not know this yet, but I'm pregnant, and hearing about how my sister, a nurse, is treating pregnant women just makes me scared for labor and delivery. My husband and I called the hospital where my sister works and explained what my sister said about her patients to me. I went into detail about what I could remember and just reported it. They thanked me for letting them know, but I don't know what further action they would take. My sister is taking the night shift tonight, and she has yet to call me screaming, so we will see what occurs in the next few days.